Okay, so today and tomorrow we're going to talk about public health and how that's involved in preventing these different diseases that we've kind of been talking about the past few days and how it's involved in preventing pathogens from spreading from one person to the next. Okay, so public health we've sort of talked about at the beginning of the year, but I'm going to remind you what it is. Public health is a field of science, so it's a type of science just like biology and chemistry. But this type of science deals with protecting and improving the health of people in a community. So public means like the public world, the community, and health is like their well-being. So public health is about protecting people from being sick, okay, from having disease. So it's about protecting and then it's also about improving. So making sure that the community's health is getting better. So if there's certain diseases being spread or certain lifestyle choices that are affecting a community, like eating a lot of fast food, public health workers work to improve the community to make sure people are living a healthier life. So one key thing we're going to focus on with this unit is the fact that public health workers work to make sure pathogens, so these different microorganisms that cause disease, are not being passed from one person to another. So they're not being spread. So that's the key thing that public health workers can really do. They can really make sure that pathogens are not getting spread from one person to the next. They can also just prevent disease from happening in general, so prevent pathogens from coming to a community in the first place. All right, so the two things that public health workers are really trying to prevent are epidemics and pandemics. So you may have heard of these terms like in the media, especially in the news with the Ebola epidemic and Ebola outbreak. So I want to clarify what these two terms mean because a lot of people use them, but they use them incorrectly. So an epidemic is an outbreak of a disease. So an outbreak means a disease is being spread from person to person. It's not just being kept with just one person. It's really being spread around an area. So an epidemic means it's affecting people in a smaller area. So maybe an area of a state or a city or a region of a country. It's just a smaller area. That's an epidemic. So the disease is being spread, but it's not being spread everywhere in the world. A pandemic is much more serious. It's an outbreak of a disease that spreads across countries. That's the key thing. It needs to spread from one country to another. Usually it's being spread from one continent to another continent. So it's really getting spread across the whole world. Okay? So the way diseases spread are usually through the air, contact, like human contact, or through a vector. And a vector is an organism that transmits a disease. So if you think of like a mosquito carrying malaria, malaria is like a more common disease in other countries. And a mosquito actually carries malaria in it, and when it bites you, it passes malaria to you. So the mosquito is the vector that's taking that disease and giving it to you. Sometimes diseases are just spread through the air. Others are more through contact or contact with a bodily fluid like mucus. Okay, we know about different diseases like that. Okay, like the common cold. So depending on how a disease is spread, it makes it either easier or harder to prevent the spread of disease. Like obviously it's very difficult to prevent diseases that are spread through the air because we all just inhale the same air and that's harder to do. We may have to really separate a person who is sick from the rest of the community to prevent the spread. But others are easier, like through contact. Okay, we just need to wash our hands more. Okay, we could prevent disease like that. Or through a vector, if a disease is spread through a vector, we need to make sure we're not coming into contact with that vector. We're not touching mosquitoes, we're not around mosquitoes like that. Okay? Okay, so the key thing that public health workers worry about are diseases caused by bacteria and viruses. And these are diseases that really can be prevented or cured pretty easily. So with diseases caused by bacteria, it's harder to prevent those diseases for sure from coming to you. I mean, you can wash your hands, you can be very sanitary and clean, but you may end up getting a disease caused by a bacteria. The good thing with diseases caused by bacteria is we can cure them. We have usually an antibiotic that can kill off the bacteria in your body. So you'll go to the doctor and they'll prescribe you, and you'll go to a pharmacy to pick up an antibiotic. So an antibiotic is something that combats the bacteria in your body. And for a lot of diseases caused by bacteria, we already have different antibiotics that for sure kill off that disease. So if you get a disease caused by bacteria, it's not a huge deal because we usually can kill off the disease and cure the disease in your body. Viruses are a different story. Diseases caused by viruses can't really be cured. Once you have the disease, like the common cold, you have to just kind of suffer through the symptoms. And usually there are medicines, which you can get all the time, that make the symptoms like less worse. They'll make them a little bit easier to deal with, but they're not curing the virus. You have to kind of weather through the virus and let the virus go through your body and let your body attack the virus. There's no medication that a doctor can prescribe you that's going to kill off the virus. Instead, to deal with viruses, doctors use vaccines. So vaccines are used to prevent you from getting the disease caused by the virus in the first place. So a vaccine helps you become immune to the disease, which means you can't suffer from the symptoms of the disease and you can't spread it. So if you're immune to a disease, you won't really have the symptoms of the disease and you can't spread the disease. So obviously the key example is the flu vaccine. You can get that every year, and usually it changes every year because the virus is changing so much. So you get the flu vaccine. The vaccine itself is a weakened form of the virus that they're putting into your body, and your body fights it off and then is immune to the virus in the future. So once you get a virus, there's nothing we can do to cure you from it, but there are a lot of ways with this vaccine that public health workers can make sure that you don't even get the virus to start with, or get the disease caused by the virus to start with. Okay, so public health workers, what they do, we've kind of been talking about it already, but here are a few key things that public health workers do to stop the spread of all sorts of diseases. First thing they do, and they've been doing this for hundreds of years, is encouraging good hygiene. Hygiene is just cleanliness. So washing your hands, bathing regularly, all those kinds of things. Public health workers at one point really had to tell people to do. Okay, wash your hands before you eat, wash your hands like after you go to the bathroom. Those are key things that public health workers try to spread to people so that people understand it's really important to do these things to stop the spread of diseases. Okay, encouraging people to cover their mouths when they sneeze. Okay, that's going to stop the spread of germs in your mucus. Encouraging people to get certain vaccines. So when you hear about getting a flu vaccine or a different vaccine in a commercial on TV, that's a public health advertisement. That's them trying to tell you to get a vaccine to prevent you from getting sick in the first place. Okay? A lot of times, too, public health workers actually warn people of epidemics in certain countries. So they'll have sort of travel warnings, and they'll tell you not to travel to certain countries because there's an outbreak of a certain disease in that country. And then the last thing they'll do is they'll actually deliver. They'll take antibiotics to people with bacterial infections. So this is kind of a short list of things that public health workers do. They obviously do a lot of other things, especially with preventing diseases that are caused by lifestyle choices, so preventing obesity and overweight issues in communities, or alcoholism, different things like that. But these have more to do with microorganisms, which is what we've been talking about. Okay, so today and tomorrow you're going to actually work on a pandemic and epidemic research project and presentation. So you're going to pick an epidemic or a pandemic to research that has occurred in history, and you're going to research the epidemic or pandemic and then create a PowerPoint presentation about it so you can sort of understand how public health has worked in the past and how it's working today too.